Now, in order to address these and other concerns head-on, the program has taken the following steps this year. ORM has hired a new manager of the public sector's workers' compensation program. ORM has redrafted the workers' compensation regulations, which should be published in final form within the next 1 to 2 weeks. The program has held writing improvement class for claims examiners with the Office of Attorney General and Administrative Law Judges. We've met with major agency heads to review workers' compensation cases and data, which includes types of claims that emanate from each agency. ORM has assigned claims adjusters to work with specific agencies to improve the working relationships with agency staff and to familiarize adjusters with agency policies, procedures, and human resource needs. Within a 6-month period of time, we closed down an office and relocated half of the staff of the third-party administrator to One Judiciary Square in December so that ORM can improve managerial oversight and the delivery of better customer service. ORM has implemented weekly meetings with claims adjusters to scrub their cases with senior management in order to map out a strategy to return employees to work where warranted. For the first time in the program's history, ORM has instituted a monthly orientation program for all new workers' compensation claimants to attend so as to educate them about the program and change the erroneous mindset that the program is a long-term retirement program. We met with the senior leadership of Sedgwick on 3 occasions to inform the company of the agency's new goals and expectations regarding improved performances and customer service. We are now returning around 30 to 45 injured employees back to work per month. We've created a non-departmental fund where monies can be used to fund government positions for injured workers who are eligible to return to work. We've received approval to hire a return-to-work coordinator, a program analyst, and a compliance auditor to assist the government with our return-to-work initiative. We're currently interviewing for these positions. As you know, we passed emergency legislation that requires injured workers to fill out and verify income and other earnings while on workers' compensation, and to release income tax return data from the federal and district tax authorities to ORM officials. We have explored alternative methods for providing vocational skills and training to injured workers, including talking to the D.C. Department of Employment Services about utilizing its employment hiring resources, and we've also directed the current vocational rehabilitation vendors to develop and utilize creative and innovative practices for building the skill sets of claimants and facilitating their return to work. We've referred cases to the Office of Inspector General, the U.S. Attorney's Office, and the Office of Attorney General for criminal prosecution and civil collection of money because we received evidence that fraud may have occurred. We've discussed with the Board of Medicine the referral of physicians to the board for possible disciplinary action where there's evidence that doctors have either overtreated injured workers, facilitated the addiction of employees to narcotics, or rendered care outside of medical standards and protocol. We're now working with the D.C. Department of Human Resources, the Office of the Chief Technology Officer, the Office of Pay and Retirement Services, and the Office of the Chief Financial Officer to implement the PeopleSoft Conversion Project, which is a huge interagency project that was established so that ORM can efficiently collect life and health insurance premium payments from the paychecks of injured workers so that premiums can be electronically transferred to insurance vendors. We've increased the investigation and surveillance of workers' compensation recipients where medical records and facts reveal that workers are out of work longer than they should be for the type of injury sustained by the employee. We've also audited the performance of Sedgwick. We've increased independent medical examinations in cases where claimants have been receiving benefits for years, but there is no record that they have either seen a physician within the few years or taken any type of medication. We've audited workers' compensation files. We've published an extensive legal memo which sets out the rights of pre-1980 employees and employees hired between 1980 and 1987. We hold monthly roundtable discussions with the Office of Attorney General. We've designated the Police and Firefighter Clinic to serve as the designated physicians for law enforcement type employees since they have expertise in the area. And we've also invited stakeholders, some of whom have testified today, to discuss program initiatives and to provide commentary on proposed regulations. We've enacted legislation limiting the number of years that injured workers can receive workers' compensations to 10. We've implemented a customer service survey that allowed claimants to evaluate the performance of Sedgwick, and we've also developed internal workflow measures, operating procedures to improve work performance of all workers' compensation staff. Within the last year, every agency has been given direction that they are to participate in the agency's return to work program. In fiscal year 2009, 21 agencies participated, and I'm happy to report that we have that number now up to 38. Also, as a result of returning 557 employees back to work in fiscal year 11, the program saved $2 million in fiscal year 11. ORM plans to continue to improve its managerial oversight over Sedgwick, especially in the areas of customer service and the timely delivery of services. A Sedgwick representative attends senior management meetings because it is important for the company to hear positive and negative comments that are being voiced about its performance. Training courses are now being offered to Sedgwick adjusters, and within the last 3 months, ORM began to send claimants customer service surveys to fill out so that we can measure Sedgwick's performance. A good number of Sedgwick employees have worked tremendously hard and long hours to assist the government in its return to work efforts, and I commend them for their performance. However, since relocating Sedgwick to 1 Judiciary Square, I have had an opportunity to observe and to evaluate the performance of this company. And I'm in total agreement that there must be improvement in customer service and timely deciding requests for compensable services. In fact, within the last few weeks, I have been in frequent contact with Sedgwick senior corporate and regional officials to discuss Sedgwick's overall performance with this program, particularly since this is a critical period of time where the government must decide whether to exercise its option to continue its contract with Sedgwick for another year, or proceed with initiating the procurement process to look for another vendor to provide third-party claims administration to this program. In the field of litigation, we continue to meet with OAG lawyers. There was a decrease in hearings between fiscal year 2010 and 2011. However, as a result of the Return to Work initiative, more than likely the claims will increase. Finally, as a result of the emergency legislation that was passed this summer that provides ORM with the authority to collect income information, what we've noticed since implementing this program is that we've received a lot of affidavit of earnings and income information that shows a lot of people receiving workers' compensation have also been receiving income either from working or participating in other revenue-generating activities. There have been little change in the number of workers' compensation cases that have been filed over the years. The numbers have been relatively constant, around 1,400. We've also looked at these cases and we've been able to ascertain the common type of injuries that occur in the workplace. And they tend to be strains, falls, lifting, and automobile accidents. Now, the Office of Risk Management also has an insurance program and medical liability captive insurance agency. And what that program does is we work with the Office of Contract and Procurement to assess insurance requirements on any procurement over $100,000. And we look at these contracts to make sure that contractors maintain those type of insurance which protects the government. Last year in fiscal year 11, ORM conducted 199 contract assessments of insurance requirements for district contracts. In addition to that, we participate in insurance training. As you heard earlier from another witness, the Medical Liability Captive Insurance Agency provides medical malpractice insurance to nonprofit community health centers in the district so that these entities can insure clinics and their medical staff. This allows the 4 clinics that we provide coverage to remain open. Currently, we provide 1 million single occurrence insurance coverage and 3 million medical malpractice liability insurance for all occurrences at each clinic. Thus, the total aggregate limit of insurance coverage for all 4 healthcare centers is 3 million. Currently, the captive is in a vulnerable posture because in past years, the government has issued an insurance policy that provides this $3 million of medical malpractice insurance for all occurrences for all 4 clinics. However, as indicated earlier, there's only $2.5 million that has been placed in the captive budget. ORM was of the understanding that approximately $2.5 million remaining in the captive budget at the end of fiscal year 11 would remain available and rolled over in fiscal year 12, since it's by statute a non-lapsing fund, and that the captive would have an estimated budget of around $5 million. In fact, ORM staff worked with government officials to draft language in the Budget Request Act to facilitate this rollover. As a result of this, we informed the Captive Advisory Board that it would have $5 million in the fiscal year 12 budget, as it did around last year, and issued a policy of up to $3 million, as was done last year. However, several months after the issuance of this policy, ORM discovered that the $2.5 million from the fiscal year 11 account did not roll over. Consequently, there's insufficient money in the budget to cover the $3 million policy. We brought this attention to the administration, and the administration has committed to pursuing various options to fix this problem. It is being currently looked into at this particular time. After assessing the risk exposure data for the clinics and determining the insurance market premium rate for the 4 clinics, ORM determined that the medical liability insurance that the government is providing the clinics have helped the clinics save around $190,000. That is, if they were required to go onto the private market to purchase that type of insurance. Within the last year, 1 lawsuit has been filed against one of the clinics that used to be with the captive. And since we provided insurance coverage for that particular clinic, we're responsible for making sure that the clinic has the appropriate legal resources to defend itself against the lawsuit. Finally, the Captives Advisory Board has met twice during the fiscal year, and we reconvened the Advisory Board last year. And the board is comprised of distinguished members of the medical, risk management, and legal fields, and they've offered invaluable advice about how the district government can improve in insuring the clinics, as well as reducing risk in the district, particularly in programs where we provide health care service.
Okay, Director, I'm going to jump in here, and I have the balance of your testimony.